Our story begins on Columbus's Near East Side, a once vibrant urban neighborhood whose fate mirrored that of many inner-city neighborhoods across America. Overlooked for decades, economic instability caused a tragic domino effect. Yet, where others saw ruin, The Ohio State University envisioned hope, responsibility, transformation. The university began making investments in the community in coordinated ways, joining forces with residents, the city, and community partners to turn hope into action.
Began with a phone conversation I had with the mayor's office, who was describing a partnership that was emerging between the Ohio State University, CMHA, Columbus Metropolitan Housing Association, and the city of Columbus. And their focus was the revitalization of the Near East Side.
Ohio State's initial investment spurred a $280 million reinvestment in the community, which included a $30 million Choice Neighborhood Grant from the U.S. Department of Housing and Urban Development. HUD Secretary Sean Donovan came to Columbus to announce the award and reveal that the city's application scored the highest of the 44 nationwide.
We believe he came here to do that because of the quality of the work and the magnitude of the project that we were undertaking and the partnership that had been formed.
But housing alone wasn't going to revitalize the community.
Education became a focus. Young families would choose communities in which to live based upon the quality of education available to their children.
Ohio State worked with Columbus City Schools to strengthen science curricula in all 6 area public schools, creating a pipeline to careers in healthcare. Today, medical students and health professionals teach and mentor students. Hospital employees volunteer at the schools, and area students participate in hands-on learning in clinical settings. Ohio State is a strong community member of the Near East Side, and with its East Hospital and Outpatient Care East, they're one of the largest employers in the area and the largest healthcare provider with a focus on improving the health of this underserved population.
This is not, for them, a project where they come and go.
Over the last 15 years, I've seen a lot of changes. The community is getting healthier. The community is getting more educated about things. The community, they're receiving more screenings. The community is actually gaining more because these things are available to them.
Ohio State's work in the Near East Side is only part of the story. Students, faculty, and staff have worked with countless stakeholders to develop and manage programs that address and combat pressing problems, such as health conditions that disproportionately affect minority populations, health access, and health equity across Central Ohio. La Clinica Latina is one of Ohio State's many student-run specialty clinics. It's a part of the Columbus Free Clinic, which serves the general community, along with the Asian Health Initiative Free Clinic, the Newer Community Clinic, and the Rainbow Clinic that serves the LGBTQ+ community. In 2021 alone, students conducted more than 2,000 patient visits and distributed more than 1,500 free prescriptions. Telehealth appointments, which were initiated during the pandemic, further expanded patient care and student learning. Serving the community is an integral part of the college curriculum.
One of the things that Ohio State does is they put their students into the clinics in their first year.
Well, I've definitely learned how to interact with patients, which as a first-year medical student is not a super common occurrence.
Students also connect patients to other needed medical and social services while learning how cultural beliefs and customs affect health. Impactful programs with key partners are at the heart of Ohio State's efforts to improve the health of at-risk communities. Moms to Be, a community-based pregnancy program for low-income women, was established in 2010 and has grown to serve 8 neighborhoods in Central Ohio.
When the program was first started, the infant mortality rate in Ohio was one of the highest in the country. We've since made changes and made improvements in that rate.
During weekly programming, moms interact with nurses, social workers, child development experts, and dietitians. They get connected with resources and education as they navigate pregnancy and the first year of their child's life. Moms-to-Be addresses gaps in care, which is critical in ensuring the health of both mom and baby.
During my pregnancy, I was high risk. I had gestational diabetes. They reached out to me like once a week, and she was sending me helpful materials on what to eat, and she, I think, was calling me like once a week, checking on me, and that was one of the helpful things, honestly.
Our moms are, thriving in our education. They attend by Zoom, they come in person. We really create it's like a little family.
Ohio State's commitment to transforming the health of our communities touches every corner of the state. Funded by the National Institutes of Health, Ohio State is leading a consortium of academic, state, and community partners. The aim is to reduce opioid overdose deaths across the state of Ohio.
We began to look at this and realize that we could bring together the strength not only across multiple colleges at The Ohio State University with our state partners, but in fact the coalitions across Ohio, but also across 6 other academic centers. So what implementation science and the Healing Community Study is in fact does is to say, are there more effective ways and strategies that we can study to actually help implement, to adopt, and to get out to the people who need them most, approaches that would reduce opioid overdose deaths and put people into long-term sustained recovery.
One city in the nation in great need of help is Portsmouth, Ohio. Once a preeminent Appalachian city on the Ohio River, it had been emptied of factories, opportunities, and hope. The small community became overrun by drugs, poverty, and despair.
So Portsmouth was really ground zero for the opioid epidemic. The pill mills originated here. I think the Healing Community Study coming in, bringing in not only funding, but dedicated staff and professional resources was a kind of glimmer of hope.
The Healing Community Study gave the existing coalition of community members and organizations in Scioto County a framework to integrate evidence-based interventions, resources, and solutions.
Ohio State came in and wanted to work as a partner. They valued the knowledge and expertise of the folks that were here.
We moved from that kind of very early learning to get to know each other to truly having one voice, one direction, one true north, and understanding how each of us could bring our individual talents together and work to address the individualized needs of a community rather than a one-size-fits-all for everybody.
In 2021, we were able to distribute over 3,000 Narcan kits into Scioto County.
We have been able to see a 25% reduction in overdose deaths. And that is directly related to the work that we've done with healing communities in Ohio State.
The Healing Communities Study will inform how we move forward as a state and a nation to reduce opioid misuse and overdose deaths.
We worked very heavily on sustainability, so these programs aren't going to just be here for a year or two. These are long-lasting programs.
At The Ohio State University, as the land-grant institution, we have a moral imperative to meet the needs of the citizens of our state, and in fact take that knowledge and actually translate it not only to the nation, but in fact for benefits for the world.
Through all of these groundbreaking efforts, The Ohio State University is providing blueprints for community-engaged research, so together we can address pressing problems across the state, the nation, and the world.